everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a very important topic, that is the types of record. So here, as we all know, that record is a permanent written communication that documents the information which is relevant to the client healthcare management, right? So in simple words, I can say that this record is a permanent written communication that we will be documenting all the information which is related to the client. We will be documenting the client health status, the medical diagnosis, the intervention, as well as the treatment which we are providing for that particular client, right? We also know that this record serves as a permanent written communication. So it is very important that we must always record everything that is happening or that is going on with the client. So this record is very, very important, and we can also see that it is widely used in each and every hospital. Now here, when we talk about records, there are four types of records. The first one is the ward record. The second is the nurse's record. The third is the educational record. And the fourth, that is the administrative record. So now let's look at each one in detail. Moving on to the first one, that is the ward record. So here, as I said, right, that record is a permanent written communication, right? So here in ward record, what happens is that there will be a record in each and every ward. Okay, there will be different type of records which we nurse must maintain in each and every ward. The first one which we will be talking about is the patient clinical record. So here, this patient clinical record include both the outpatient record as well as the inpatient record. So what do you mean by outpatient records? So here, outpatient records are the records which is maintained for the client who only comes for the OPD, right? Outpatient department services. Whereas the inpatient record is the record which is maintained for the client who has been admitted into the hospital. So here, in most of the hospitals, we can see that the inpatient record will be the continuation of the outpatient record. So here, basically what happens is that when a person feels unwell, the first thing he do is he goes to the OPD department. He goes so that he will be able to address his problems, and so that the doctors will be able to diagnose the condition. Only after the condition has been diagnosed, and if the doctor feels that the client needs to be admitted, then only this outpatient record will also be continued when the patient has been admitted. So that is why it is said that in most of the hospital, the inpatient record is usually a continuation of the outpatient record. So, since it is the continuation of the OPD, so this record will be first filled by the outpatient department, and this record will contain all the biodata of the client. It will contain the diagnosis, the investigation which has been performed, as well as the results and the treatment which has been provided for the client. And the next record, which is usually maintained in a ward, is known as the doctor's record sheet. So here, this is simply a sheet whereby all the doctor's orders will be documented. All the doctor's orders related to the treatment, related to the investigations, related to the medications, and also related to the diet which the doctor has advised, which the doctor has prescribed for that particular client, will be documented. And the next one is the reports of the laboratory findings. So here, from the name itself, you can understand that these are the reports whereby we will be recording or we will be maintaining in that particular client's file in order, to serve it as a record, in order to be able to make a difference, in order to be able to evaluate if, there is any abnormalities in that client report. So here in the lab report, it is also very essential that the normal values are included. Why? Because if these normal values are included, then it will be very easy for us to evaluate any abnormalities, to evaluate whether that particular value of the client is either more or either less than the normal value. And the next one is the diet sheet. So here, this is a sheet whereby the diet which the client needs to follow will be documented. It can be any type of diet depending on the condition of the client. So here, for example, if it is for a diabetic client, then we will be suggesting them to have a diet which is free from sugar, right? So here, depending on the condition of the client, also the diet will vary. So this diet sheet is usually maintained so that, the particular diet which the client should follow, the particular foods which the client must avoid, will be documented. The next one is the consent form for operation and anesthesia. So here, we as nurses must keep in mind that before we perform any procedure for the client, before the client undergoes any surgery, or before even, we provide anesthetic agent to the client, we must make sure that we get the consent from the family members or from the person who is very close to the client. Why? Because here, before any operation is being performed or before administration of anesthesia, we must make sure that we educate the client as well as the family members about the importance, about why we are doing that particular procedure, and also about the complications which can occur only after all these things has been told, only after all these things has been educated. If the client and the family members, wishes to do so, then we must take this consent form whereby they will be able to put their signature, so that later on, if anything happens after the procedure, this consent form will serve as a proof that before the procedure has been done, all these things has already been told, all these things has already been educated to the client as well as to the family members, and they are also ready to take the responsibility of whatever may happen after the procedure. The next one is the intake as well as the output chart. So here, this is a chart whereby we will be recording the intake as well as the output of the particular clients. So this chart can include the IV fluids, the oral fluids, the Ryle's tube feeding, the gastrotomy tube feeding, the input-output chart, which is maintained for the client in critical illness, or if the client is suffering from condition like diarrhea, or also after any surgery has been performed for the client. So as we all know that, in case if any surgery has been performed for the client, there's a possibility that there will be a difference in the intake and the output chart. So in order to monitor that, we should make sure that we record the input and the output chart. We record how much fluid they are consuming, either it be through orally or through any, intravenous fluid. And we must also record the output which, the client is having. Because why? Because in case if the intake is more but the output is less, or if the intake is less and the output is more, then through this input output chart, this will help us indicate that there is some problem with the client. And the next is the reports of the physiotherapy or the occupational therapy if the client is attending any. And the next one is the Cardex. So this Cardex is the recording of the client data after organization and making the information quickly accessible to all health personnel. So here this Cardex is nothing but a type of record whereby we will be recording the client's condition after, we have organized it, and this will also make this information become quickly accessible to all the healthcare personnel who are involved in that particular healthcare team in order to help the client promote their health. And then the next one is the instruction book. So this instruction book is nothing but a book which will be maintained in order to note down any instant instruction which has been provided by the physician during the rounds. So here, in case any instructions has been provided by the physician during their rounds, in case any instruction has been provided by the physician while he or she has been examining the client, then all of these must be recorded in the instruction book. The next one is the admission and the discharge record. So as I've told in our previous session, that admission means taking the client into the hospital, right, in order to provide treatment. Whereas discharge means after the client has been admitted to the hospital, after he has been receiving the treatment, and after you have made sure that the client health is progressing, after you have made sure that the client is attaining his normal health status, then we will be discharging the client, right? So here, in a ward, it is also very important that you must maintain this admission and discharge record. So what should this consist of? These records should consist of the name, the age, the sex, the address of the client, the date and time of admission, as well as the diagnosis of the client. Why? Because it is only through these records that we will be getting an idea of the total number of the admissions which has occurred per day. And also, when the patient has been discharged from the hospital, it is very important that we must record this thing too. Why? Because this will also give us an idea of how many cases has been discharged on that particular day. And the next one is a census record. So this is basically a record whereby the total number of the admission, of the discharge, the transfer in, the transfer out, the absconded cases, as well as the death of the client will be recorded. And the next one is the call book. So this is basically a book whereby it will be including the name of the doctor, the date, the time, as well as the purpose of why this doctor has been called at that particular moment, or why this doctor has been called in the emergency situation. The next one is the complaint book. So this complaint book is a book whereby all the complaints can be noted down. This complaint book is the one whereby, it will be consisting of all the repairs which is required in the ward, which, can be related to the machineries, to the electricity, to the water supply, or even to the equipments which are present in the ward. So through the use of this complaint book, you will be able to document all these complaints so that the necessary actions can be taken as soon as possible. And the next one is the movement register. So this movement register will be giving the information regarding the availability of the doctors as well as of the nurses which is concerned. And the next one is the movement register. So this is a register which will be giving the information regarding the availability of the doctors and the nurse concerned. So through the use of this movement register, you will be able to get an idea about the place which this doctor or this nurse is at that particular time. And the next one is the indent book. So in this indent book, what you will be doing is that you will be recording the total number of all the equipments, of all the machines, of all the linens, the medications, the IV fluids, the gauze piece, the cotton, or anything which is present in that particular ward. So through this indent book, you will be able to get the total number of all the things which is present, and daily you need to document it in order to still maintain that count. The next one is the drug maintenance register. So this is a register whereby it will contain all the drugs which is present in that particular ward. The prescription and supply of drugs generates a variety of records, including the pharmacy stock ordering, dispensing records, requests of drugs from store, drug drug administration record, the prescription for individual patient. The receipt as well as the issue of all the drugs should be recorded. So this drug maintenance register is usually a register whereby all the things which is related to the drugs will be recorded, like be it the drugs which has already been present in the ward, or the drugs which is required by each and every individual because it has been prescribed by the physician, or the drugs which has been requested from the store, or even the pharmacy stock ordering and the dispensing records will be maintained. So these are all the records which will be maintained in a ward. That is why all of these is known as the ward records. Now moving on to the second one, that is the nurse's record. So here the office of the chief nurse will generate records of the type found in the office with an executive or the administration function. So this nurse's record is a record which will include everything that the nurse has been performing for that particular client. Okay, this record is the one. It includes the correspondence, the reports, as well as the minute of the meeting. So as we all know that each and every nurse will be present in every ward, right? So here it is also very important that when a nurse is present in the ward, she must maintain her own nurse's record. In the ward, the nurse may also maintain the admission register. So here, while maintaining this, the following points will serve as a guide in selecting the importance. So the first one is the symptoms that are intense in character. The second one is the persistence over a period of time. The third is the one that indicates a change in the condition of the client. The third is any impairment or even the loss of function of an organ or any part of the body. Then something that recurs at regular or the stated intervals, and something that may become progressive or even more severe. That something may indicate development of complications or even something that requires treatment beyond the ordinary nursing measures. So in the ward, it is very essential that you must not only maintain the nurse's record, whereby you will be noting down each and every procedure you have been performed for each and every client. But here, when you are in a ward, the nurse may also have to maintain the admission register. And so while you are doing it, the following points will serve as a guideline in order to be able to select the importance. So the first one you should state about is the symptoms that are intense in character, then the persistence over a period of time, then the indications or any changes in the condition of the client, then any impairment or loss of function of an organ or part of the body. Then after that, you must also document or record anything that records at regular or stated interval, and something that becomes more progressive or severe, anything that can indicate the development of complication, and also anything that can require treatment which is beyond the ordinary nursing measures. So here, as a nurse, it is very important that whenever you are in a ward, whenever you are providing care to the client, you should not only document what you have been providing, what the interventions you have been doing, but you must also keep these things in mind, because why, here in a ward, you are also responsible to maintain the admission register. The next one is the graphic chart of the TPR. So here TPR stands for temperature, pulse and respiration, right? So here what happens is that in this graphic chart, the temperature, pulse and respirations will be recorded, right? So with the help of this chart, any slight deviation that occurs in this TPR of the client will be noted at a glance. And not only TPR, but also any other information such as the blood pressure, the number of the bowel movement, the urinary output, the weight of the client, the name, the date of the operation, the removal of sutures, etc. may be recorded on this chart. So this graphic chart, is very commonly used. Why? Because it is very easy to make out any deviation which can occur in the client health status. Now moving on to the next one, that is the educational record. So here the officers, board and the committee of the medical as well as the nursing school will produce their own records, their own minutes, correspondence, reports and so on. So here this educational record may also be found if there is a teaching component within the hospital. So here educational records. So as soon as you hear this, you should not only think that it is only related to the educational schools or the educational institution, but here it can also be related to the hospital itself, if it is for those hospitals which has also inculcate the teaching component into it, so that they will be able to educate the nurse, so that they will be able to improve the knowledge of the nurse. Not only that, but also through the use of this education record, you will be able to reports and so on. And this educational record may also be found if there is a teaching component within the hospital. For example, we can say that the letters of appointment, the joining reports, the job description, as well as the service record of the staff members. So these are the various things which you will be finding in an educational record. The next one is the administrative record. So here in the nursing superintendent office, the hospital also requires the record which is related to the finance, personal, building, accommodation, stores and other such services. although they may be a little different from the ones which is used in the non-medical organization in an equivalent size. So besides these records, also the annual as well as the statistical reports will probably be prepared, providing a summary or providing a summarization of the hospital activity. So here in the administrative record, what happens is that you will not only have a record of the accommodation, of the stores, of the buildings, of the finance, of the personals which is present in that particular hospital, but here it will also include which will be helping in providing a summarization of whichever activity has been going on in that particular hospital. So this administration record can also include the philosophy, the purpose, as well as the curriculum. It can include the course, the content, the course plan, record for each and every subject. It includes the rotation plan for the duties of the staff nurse. It also includes the minutes of the committee meeting. It includes the record of the committee, the record of the academic requirement, the stock register, annual reports, affiliation records, written policy statement of the budget proposal as well as allotment, copy of the brochure, photography, videos or paper cutting of any important events that has occurred in the hospital. So these are the various records which you must maintain in the administration record. Now moving on to the next one, that is the school office record. So the school office record is divided into three categories. The first one is the record which is concerning the student. The second is the records which is concerned with the staff of that particular school. And the third one is the general school record. So in the records which is concerned to the student, there will be the application forms as well as any other reports which is called for at the time of recruitment, at the time of selection, and at the time of appointment, such as the reference, the medical report, the school record, as well as the results of any test that has been carried out at the time when that particular candidate has been selected. Then also it includes a record of each student clinical performance as well as a progress report which will be showing the grades and any other pertinent information. It also includes the final record, or we can say the permanent record, which will be giving a summary of the instruction, of the clinical experience, of the grades, as well as any other relevant material. It also provides the health record, the admission record, as well as the anecdotal record. So these are the various things that will include in the record concerning each and every particular student. Now next, let us see what are the records and the reports which is required for the INC. So for the INC, we require the admission register, the student attendance register, the clinical experience record, the student health record, the staff attendance record, as well as the acquaintance record. Not only that, but it also requires the internal assessment register, the external assessment register, as well as the reports of the various committee. Now moving on to the second category, that is records concerning the school staff. So here each and every staff member must have their own separate file which will be containing the application form, the letter of appointment, or any other subsequent letter which will be showing the changes in the status, the job description that will tell what candidate is expected to do in each category, the record of the staff members' educational qualification, their previous experience, any membership in the professional society, such as contribution of articles in any journals, holding office in associate of any organization, or even the participation in seminars, conference, etc., the periodic evaluation or the progress report, the leave record, the health record, as well as the anecdotal record. So these are the records which must be present in each and every file of a staff member. Now moving on to the last category, that is the general school record. So each and every general school record should consist of the philosophy objective as well as the curriculum of the school, the written policies of the school, as well as the statement of the budget proposal and the allotment, the letters of agreement with the affiliating agencies, the minutes of the staff meeting, as well as the copy of the school brochure. It should also contain the inventories of stock as well as the number of admissions. So these are the various things which should be included in the general school record. So these are the various things which must be included in the general school record. So now we have come to the end of this topic. So in today's session, we have discussed in detail about the four types of record, that is the ward record, the nurses record, the educational record, as well as the administrative record. And in the end, I've also told you about what are the various records and reports that is required for the Indian Nursing Council. So I hope you guys have got a clear understanding of this topic. I'll be meeting you guys in another session whereby we will be discussing about the furthermore topic of this particular unit. So until then, have a good day. Thank you.